Today, we are going to talk about most avoided but very serious disease rapidly spreading in India. That is HIV, or human immunodeficiency virus. HIV is a virus that targets the body's defenses against infections. Symptoms: a person can have fever, body aches, sudden rash all over the body, sore throat, night sweats, ulcers of mouth, weakness. It is very difficult to identify it, as these are very common symptoms of any other illness. The only way to know is get tested. Virus can stay dormant in body for several years before it converts to AIDS. HIV is not a death sentence, and those who have it can live healthy lives with little attention and proper medication. Testing. If you feel you have any of these symptoms, you don't need to be afraid. Even if you go for testing, your status would be completely confidential. Labs always ask to sign a consent form. You can have an HIV test and treatment beyond the age of 13 without your parents' knowledge. HIV tests are a bit expensive, but there are other ways to get tested for free. First, public hospitals. The government is very vigilant. Mostly all the government hospitals in our country have a separate ICTC centres under National AIDS Control Organisation. Free HIV testing is available there. The list of public hospitals with these centres can be fetched online easily. Second, NGOs. There are also many NGOs which sponsor your tests for free of cost. If you are not comfortable going to a hospital and talk to a counsellor, you can contact NGOs like Safe Zindagi, AFH, or few other NGOs you can find for home HIV test kits for free or home sample collection. They also can be accessed online. Third, private labs. You with getting you tested for HIV. If you are only scared of HIV and want to get tested for HIV only, it can cost you anywhere between 200 to 500 Indian rupees, depending on your state. Causes. Primary cause of HIV transmission is sexual contact. But that is not always the case. Recently, in July, 800 children in Tripura got HIV transmission due to intravenous drug abuse, in which 42 died. Needle sharing, blood-to-blood contact, contact with sexual fluid while vaginal sex, anal sex, oral sex, blood transfusion, and mother-to-child. Closed-mouth kissing does not transmit HIV, but there may be a slight risk associated with passionate, open-mouthed kissing. Prevention. Avoid having multiple sexual partners and limit your sexual partners. Talk to your partner openly about HIV before getting into a new relationship, because anyone can have it and they might not know. Second, follow safe sex practices, such as using condoms and dental dams for oral sex. Third, take PrEP if you are at high risk of HIV. Fourth, as soon as you think you might have been exposed to HIV, take PEP. You must take this emergency drug for a total of 28 days. Fifth, make sure needles and equipment are sterile at barber shop or any medical facility. Sixth, to lower the chance of HIV infecting your unborn child, get medical attention if you are pregnant and HIV positive. Last and best way is to sexual abstinence, which is avoid sex. That is all for today. Stay safe, stay tuned.